Hello everybody, my name is Giorgos Sakkas and today I'm going to talk to you about the lifestyle medicine approach for rehabilitation. Apart from being an exercise enthusiastic, I don't have anything else to declare. So starting around 460 BC, Hippocrates said that if we would give every individual the right amount of nourishment and exercise, not too little and not too much, would have found the safest way to health. This is the foundation of lifestyle medicine and the future approach of rehabilitation. Lifestyle medicine is defined by 6 pillars: healthy eating, increase physical activity, develop strategies to manage stress, form and maintain relationships, improve your sleep, and avoid risky substances. And of course, lifestyle medicine recognizes the link between lifestyle and health outcomes, use science behind health behavior change for moving to the next step and changing your behavior, emphasize values of lifestyle medicine prescriptions by physicians, but also by other healthcare providers that they work all together to promote a change in lifestyle. And the lifestyle approach is based on Hettler's 6 dimensions of wellness, including occupational wellness, physical wellness, social wellness, intellectual wellness, spiritual and emotional wellness. Let's see how lifestyle medicine approach is different from the traditional medicine approach. For example, we are used or taught or keep practicing the traditional medicine approach, which is a practitioner focus on individual risk factors, as we know. Patients are passive recipients of care, while physicians and healthcare providers give solutions to the best of knowledge. On the other hand, lifestyle medicine has a different approach, has a whole patients and lifestyle practices focus. So patients are active partners in their care, and long-term significant lifestyle changes are expected. So there are two different approaches, the expert-like approach versus the coach-like approach that prefers lifestyle medicine. So the expert-like approach is, of course, we treat the patients, we educate them to the best of our knowledge. We rely on skills and knowledge of the expert, and sometimes to the very expert, like the subspecialization experts, strives to have all the answers because we are the scientists, we are the physicians, we know all the answers, so we have to give the answers. Focus on the problem that the patient reports, or we as healthcare providers, assuming that the problem is, and advise accordingly to the best of our knowledge. On the other hand, the coach-like approach is help patients to help themselves. We build the motivation, confidence, and engagement of the patient to the overall approach. Rely on patients' self-awareness and insight. Strives to help patients find their own answers. Focus on what is working well on them and collaborate with the patients to find the best solution. And if we analyze the words expert or coach, we will see that expert is examine, x-ray, plan, explain, repeat, tell. On the other hand, coach is a curiosity, openness, appreciation, compassion, and honesty about the problem and the solution. So is it easy to change from the expert-like approach to the coach-like? How is changing from advising to negotiating with the patient for the best solution? There are different steps to achieve them. So first of all, we need to share knowledge with the patient. Active listening, not just listening, just really pay attention to what the patient said to us, asking questions, repeating actually the statements that we heard from the patient, approaching the problem and taking responsibility for the solutions we offer. And as we say in marketing or management, they say tell and sell. We need to promote what we are teaching. Teach as much as possible. Inform the patient because knowledge is the power. However, before we educate, before we teach the patient, we need to ask for permission, because this is the coaching approach. Ask for permission before we educate. Provide information just in time when you figure that there is an opening, there is a window open for that opportunity. But before that, check if the patient is ready and willing to hear the information. Most of the time, when they are stressed, they don't want to hear, that they are not ready to change. They are not ready to move to the next step. Knowledge is powerful, it's very powerful, but alone, it's often not powerful enough to elicit lasting changes. And we've seen that because patients relapse. They start smoking again. They go back to old eating habits. They get back to addictions. They stop exercising. What we can do to promote a better lifestyle? So there are some simple steps before we go to this answer. Are we doing that to every patient? Or we select the more motivated? What happens if we have only 30 seconds to promote a better lifestyle? What we say? What if we have only 5 minutes? What we do if we have only 10 minutes? This is everyday life. We don't have time to talk to patients. Yes, we talk to every patient. Make a point of addressing lifestyle issue with every patient, even briefly, even if it's only for a few seconds, like, have you eaten any apple today? Or how many steps have you counted today? Take lifestyle vital signs, for example, BMI, physical activity level using the cell phone. Ask about fruits and vegetable intake. Ask about smoking history. Ask about alcohol consumption. And prescribe lifestyle medicine approach as the first line treatment for most chronic illnesses. What happens if we have only 30 seconds? Tell patient how important and how you strongly believe in lifestyle issues and try to address them the next time visit. Schedule a follow-up visit for the current condition and carve out at least 2 minutes for addressing one lifestyle issue, and maybe arrange a visit for the next time to talk more about that. Schedule a prevention visit if possible with one of your colleagues, healthcare providers, nurses, exercise trainers, or other trained people. What happens if we have 5 minutes to talk about life change? Then choose one area of concerns that patients and which is ready to address, for example, smoking, or exercise, or nutrition, or stress. Ask patients about what specific steps we would like to do and take. Develop a brief action plan, one small step at a time. Baby steps, remember, baby steps. Check patient's confidence level about changing that. And if patient is not ready for an action plan, offer a brief message appropriate to the patient's stage of readiness. For example, hello, Mr. Smith. I would like to take the stairs once a day. Don't take the elevator. This is the only thing I'm asking you to do. Take stairs once a day. And then you can use the elevator as much as you want. What happens if we have 10 minutes or more? Then we can address 2 or more lifestyle areas, for example, sleep, exercise, and nutrition, and assess patients how ready is to make the change. Try to use motivational interview or developing a brief, specific action plan for helping them to follow your steps and your lead. There is also a 30-second strategy, and this is very, very well put it. Just leave an apple on your desk or your helmet on your desk every time you meet the patient. So subconsciously, you pass a message that you are one promoting healthy eating, but you are also healthy eater. You use your bike coming to work, or another approach that can give an indirect message to your patients that you are actually practicing what you're preaching. Does physician behavior matters? Of course. there is a relation between health habit of the physician and the practicing and the way they're counseling their patients. And studies have shown that physicians who exercise are more likely to counsel their patients to exercise. And more particularly, if they do aerobic training, they will counsel for aerobic training. If they do strength training, they will counsel for strength training. And of course, you need to know the main barriers to counseling on exercise, which is most of the time inadequate time. Patients complain about they don't have time to exercise, or lack of knowledge or expertise. So starting from the beating the patients to follow our advices to disease-centered care versus patient-centered care to the future, which is the wellness. Is the wellness of the overall approach of rehabilitation, including environmental, emotional, intellectual, physical, social, and spiritual wellness to promote a full recovery without leaving room for patients to relapse. So if you do your maths, body, mind, soul, spirit is all about you. Thank you very much for your attention.